You are about to explore the crash cart inventory and medication management. You will explore the various components of the crash cart, including the medications and equipment, inventory management, restocking procedures, and regular frequency checks to ensure the crash cart is always prepared for emergencies. Select Launch to begin the experience. A crash cart, also known as an emergency cart, is a mobile unit that carries life-supporting equipment and medications designed for easy access in emergencies. Healthcare providers such as doctors, nurses, respiratory therapists, and medical technicians use it. Now, turn around and look at the wall next to the pharmacy, where a chart is pasted to help you understand when a crash cart is used. A crash cart is vital in emergencies such as cardiac arrest, severe bradycardia, anaphylaxis, respiratory distress, and seizures. Now, let's explore the components of the crash cart in detail. The crash cart consists of the following partitions: monitoring equipment, defibrillator compartment, and 4 access and fluids drawer, a medications drawer, and an airway management drawer. The monitoring equipment includes the cardiac monitor, which helps track the heart's activity, the pulse oximeter, which measures oxygen levels, and the blood pressure cuff, which helps monitor blood pressure during emergencies. Now, use your right hand to touch each glowing handlebar to open the drawers one by one and explore the equipment and medications inside. The defibrillator compartment has a defibrillator that helps deliver an electric shock to restart the heart. Now, touch the glowing handlebar to close the drawer. The IV access and fluids drawer consists of a V catheter, which helps administer medications directly into the bloodstream, normal saline, which helps restore fluid balance, and syringes and needles for precise medication administration. Now, touch the glowing handlebar to close the drawer. The medications drawer contains epinephrine, which helps restart the heart during cardiac arrest, amiodarone, which helps treat irregular heart rhythms, atropine, which helps increase the heart rate in bradycardia, magnesium sulfate, which helps treat severe arrhythmias, and lidocaine, which is an alternative for treating irregular heartbeats. Now, touch the glowing handlebar to close the drawer. The airway management drawer consists of a laryngoscope, which helps insert breathing tubes, endotracheal tubes, which help keep the airway open, and a bag valve mask, which helps provide ventilation to patients who are not breathing. Now, touch the glowing handlebar to close the drawer. Now, some of these medications in the crash cart are nearing its expiration date. As a healthcare professional responsible for the crash cart, ensuring its readiness at all times is a critical duty. We must implement a systematic inventory management process to keep the crash cart stocked and ready. So, do you know what inventory management is? Touch yes if you do, or touch no if you don't. It's perfectly fine if you're not familiar with inventory management. Let's learn it now. Crash cart inventory management refers to the periodic control and management of crash carts' condition, chemicals, and equipment by a healthcare provider. Thorough crash cart inventory management is essential to demonstrate concern for patient life and to provide the most efficient and reliable medical services in emergency care. Now that you understand what inventory management is, let's learn how to implement it. You must now navigate to the pharmacy to discard and restock the expired medications. Now, use your right hand and touch the crash cart handle to move it into the pharmacy. Next, navigate to the pharmacy. Now you are in the pharmacy where all medical supplies used as replacements during emergencies are stocked. Next, observe the shelf on the wall. It has two trays. The green highlighted tray is the new stock tray. And the red highlighted tray is the disposable tray. Next, locate the highlighted barcode scanner on the shelf. It is used to verify each medicine's expiry status. Now, approximate your thumb and forefinger to pinch and lift the green highlighted new stock tray and place it on top of the crash cart. Next, approximate your thumb and forefinger to pinch and lift the red highlighted disposable tray and place it on top of the crash cart. Now, use your left hand to pick up the barcode scanner from the shelf. Next, use your right hand and touch each drawer of the crash cart to open it. Now, place the barcode scanner on each medicine and equipment inside the drawer to check for its expiration. Next, use your right hand to pick the expired medicine and place it on the disposable tray. Now, use your right hand and touch to close the drawer. Likewise, repeat the process for each drawer's expired medicine individually. Now, place the barcode scanner on the shelf. You have now collected all the expired medicines and equipment in the disposable tray. Now, locate the medical waste bin near the crash cart. This bin is used for disposing of medical waste. Next, use your right hand to pick the expired medicines and equipment one by one from the disposable tray and drop them into the medical waste bin. Good job! Now, restock all the medicines and equipment in the crash cart. Now, use your right hand to pick the highlighted epinephrine medicine from the rack and place it on new stock tray. Next, use your right hand to pick the highlighted V catheter from the rack and place it on new stock tray. Likewise, repeat the same step for all the expired medicines identified in the crash cart. You have collected all the medicines and equipment in the new stock tray. Now, you need to place each one in its corresponding drawer in the crash cart. Next, touch the correct drawer or the compartment where the epinephrine medicine must be placed. Now, use your right hand to pick the highlighted epinephrine medicine from the new stock tray and place it in the drawer. Next, touch the correct drawer or the compartment where the V catheter must be placed. Now, use your right hand to pick the highlighted V catheter from the new stock tray and place it in the drawer. Repeat the step until all the collected medicines and equipment are restocked in the crash cart. Well done! You've correctly restocked the crash cart to use it for emergencies. Now, you need to exit the pharmacy. So, approximate your thumb and forefinger to pinch and lift the red highlighted disposable tray and place it on the shelf. Next, approximate your thumb and forefinger to pinch and lift the green highlighted new stock tray and place it on the shelf. Now, touch the crash cart to move it out of the pharmacy. Next, move out of the pharmacy to the lobby. Did you know? For the crash cart to be always emergency ready, it must be checked daily, checked weekly, and checked after every use. As an emergency department healthcare professional, you must enter the crash cart frequency check schedule before winding up each day to ensure the crash cart is always ready. Now, head towards the right side of the wall next to the pharmacy and touch the notepad on the wall to view the crash cart's frequency check schedule. This crash cart checklist ensures that all critical equipment and medications are ready for use during emergencies. It is categorized into 3 columns representing the frequency of checks: daily, weekly, and after every use. Each item must be inspected based on the required frequency to confirm functionality, expiry, availability, and cleanliness. This helps maintain compliance with standard healthcare protocols and ensures patient safety. Next, touch the exit to exit the screen. You have successfully completed the crash cart inventory and medication management experience. Before you leave, ensure that you have explored the various components of the crash cart, including the medications and equipment, inventory management, restocking procedures, and regular frequency checks to ensure the crash cart is always prepared for emergencies. Now, touch revisit to revisit the experience or touch exit to exit the experience.